Good morning, everyone out here. Myself, Dr. Ankita Gogoi, and the title of my paper is Pupil Cycle Time and its Significance in Patients with Diabetic Retinopathy. A small beam of light focus at the pupillary margin will induce regular persistent oscillations of the pupil. The average period of these cycles is known as pupil cycle time or PCT. PCT is remarkably stable and repeatable within plus minus 3% variability. When the iris muscles are normally innervated and responsive, the PCT is dependent on the speed of nerve conduction and the number and strength of optic nerve impulses. It can be easily measured and expressed in milliseconds. Prolongation of PCT may result due to impairment of the afferent or efferent pathway of the pupillary light reflex by some diseases including optic neuritis, optic nerve compression, space-occupying lesion, multiple sclerosis, CNS depressants, progressive autonomic failure, and diabetic autonomic neuropathy. PCT is a fast, simple, reliable, and non-invasive clinical test of optic nerve function and is a sensitive measure of dysfunction of the parasympathetic afferent limb of pupillary light reflex. It has the great advantage of being objective and quantitative for each eye individually. The aim of the study is to evaluate PCT in patients with diabetic retinopathy and its role in detecting diabetic autonomic neuropathy. The authors have no personal, financial, or institutional interest. It's an observation institutional cross-sectional study. 50 eyes of 50 known type 2 diabetic patients with different grades of diabetic retinopathy were selected for the study. All patients underwent ophthalmological examination including BCVA, pupillary light reflex, slit lamp, tonometry, fundoscopy, and PCT measurement. Patients with associated ocular pathologies, ocular trauma, ocular surgery, neuro-ophthalmologic disorders, and patients using drugs that can cause autonomic dysfunction were excluded from the study. The procedure: the patient sits at the slit lamp in a dimly lit room and is instructed to look into the far distance. A thin, narrow, horizontal aligned slit of light is focused accurately on the lower part of the iris in a plane perpendicular to it. The beam of light is slowly elevated until it impinges on the pupil for the initiation of pupillary constriction and dilatations. The pupillary oscillations are observed when the time for 100 cycles of oscillations and dilatations is measured with a stopwatch, and the mean PCT is calculated by simple division to obtain PCT in millisecond per cycle. So these are the pictures. The results: the age of the patients were ranged from 42 to 74 years. The largest number of patients were 21, which were in the age group of 61 to 70, followed by 19 in the age group of 51 to 60, 7 in the age group of 41 to 50, and 3 patients in the age group of 71 to 80. It comprises of 22 males and 28 females. On examining the fundus, 18 had mild diabetic retinopathy, 22 had moderate diabetic retinopathy, 7 had severe diabetic retinopathy, and 3 had proliferative diabetic retinopathy. 2 patients had diabetes for less than 1 year, 21 patients had between 1 to 5 years, 20 patients had between 6 to 10 years, and 5 patients between 11 to 15 years, and 2 patients had diabetes for more than 15 years. The mean PCT of the 50 patients was found to be 1130 milliseconds with a standard deviation of 186 millisecond. And 5.5% of the patients with mild NPDR, 63.6% of patients with moderate NPDR, and 100% of patients with severe NPDR and PDR had PCT value of more than the average mean. And a positive correlation was also seen between PCT and the duration of diabetes. Discussion: the average pupil cycle time in males is around 928.4 milliseconds and in females it is 934 as per study of AK Sood in 1985. In the present study, mean PCT of the diabetic patients is 1130 milliseconds with a standard deviation of 186. Thus, in our study, PCT is prolonged in diabetics. Similar findings is cited in many other studies like S.A. Smith, Martin C. and L. and Kim G.C. et al. 5.5% with patients with mild NPDR, 63.6 patients of patients with moderate NPDR, and 100% of patients with severe NPDR and PDR had PCT value more than the average mean PCT, signifying prolongation of PCT with increased severity of diabetic retinopathy. In the present study, a positive correlation was also noticed between PCT and the duration of diabetes. Thus, it is seen that there is lengthening of PCT with increasing duration of diabetes. So I'm concluding saying pupil cycle time is prolonged in diabetics and has been shown to increase with duration of diabetes and increasing grade of retinopathy. The lengthening may be due to pupillary autonomic neuropathy. Thus, PCT is one of the important diagnostic method of pupillary function. It is simple, inexpensive, yet quick and effective tool to assess the pupillary autonomic neuropathy in the diabetics. These are my references. Thank you.